Kia ora koutou, ko Gillian Dawn. Most of you will know me as a midwife from Tauranga Hospital, but in case this video gets shared, I'm Gillian and I'm a midwife at Tauranga Hospital. I'm attempting to put together a video presentation on the use of essential oils for midwives as a part of my quality leadership program application. So please enjoy. I'm just going to begin with an overview on what this presentation is going to include. I'm going to start by touching on the New Zealand College of Midwives consensus statement on the use of complementary and alternative therapies for midwives, within which the use of essential oils is listed as an aromatherapy. I'm going to briefly explain my introduction to essential oils, followed by how my practice has evolved to include the use of them from 2017 onwards. I'm going to cover what is an essential oil exactly. I'm going to touch on the historic background before delving a little deeper into how they work. We're going to look at what the research says around the use of essential oils in labour and birth. And then we're going to explore a mechanism of action known as the law of vibration, which is a principle of physics. We're going to look into something called sympathetic resonance and how this helps to make essential oils especially effective for labouring women. And then I'm going to end with a brief look at some of the essential oils used by midwives and their applications. Bear with me. Okay, this is the New Zealand College of Midwives consensus statement on the use of complementary and alternative therapies. I'm not going to read the whole thing, don't worry. But I'm just going to cover one or two things here. The use of complementary therapies may assist women in becoming more in tune with their bodies and to utilize mind-body connections to help themselves through their childbirth experience. These include various forms of healing, such as therapeutic touch, massage, relaxation, meditation, visualization, and environmental manipulation, interesting choice of words, which includes the use of colour, music, quiet, and aromatherapy. The New Zealand College of Midwives recognises that these are and always have been a valuable part of midwifery practice and that this will continue to be recognised and valued. Of note here, midwives incorporating complementary and alternative therapies into their practice should have either undertaken a recognised education program or have referred their clients to the appropriately qualified practitioners. Well, it turns out, I looked into this, in New Zealand there is a massive shortage and almost zero to no education days available on the use of essential oils for midwives. So I'm looking at remedying that. I've gotten in touch with a qualified aromatherapist who is in the process of putting together a study day for midwives on this exact topic, so watch this space. And in the meantime, in the absence of any formal study day or, qualified training that's available to midwives for essential oils, this is my presentation. This is the best I can come up with until a study day becomes available, which will hopefully be before the end of this year. Okay, so I just want to start by trying to explain as briefly as possible, that's always a challenge for me, I like a good story, how I was introduced to the use of essential oils and how they came to be such a, I would say, consistent component of my practice. My practice at that time was I was working as a full-time LMC. I'm currently working as a core midwife at Tauranga Hospital, but this was back in 2017 when I was first introduced to the idea of essential oils. I'd never heard of, well, I probably had heard of them before. I hadn't really paid any attention to what they were. But effectively how it all unfolded was really unintentionally. I was, like I said, I was working as a full-time LMC at the time, and I journeyed down to Dunedin to attend a 3-day creative conference down there, which I really wanted to be at. Anyone who's worked in LMC practice will know that was really difficult trying to organise that trip away. So to get that time out of LMC practice, 2 days drive from Tauranga down to Dunedin, 3 days attending the conference, and then 2 days driving back again. So it was no small achievement that I managed to make it down there, and I was really, really looking forward to going to this conference a lot. as I arrived at my Airbnb on the Friday in Dunedin, I noticed that I was starting to feel a bit sick, like I was getting a bit of a cold. Thought, stink, bad timing. Went to bed early, like hoping I could sleep it off pretty much and would still be alright to go to the conference in the morning. And effectively what happened was, not intentionally, not even really anything that I was aware of, but I was in and out of sleep for the next two and a half days until Sunday afternoon. And by the time I kind of properly woke up again, I didn't really know what day it was. I was the sickest, probably one of the times in my life I was probably the sickest I've ever been. Really, really unwell with some kind of horrible chest infection and horribly febrile. But, you know, it was like a Sunday, coming into Sunday evening in a strange town that I'd never been to before, and I sort of was like, I've probably got no chance of getting to a doctor, and I'm about to miss this conference that I've driven all the way down here to be at, and I'll be damned if I'm going to miss out completely. So come hell or high water, I am going to the closing meeting of this creative event that I was determined to get to. It was the middle of Dunedin winter. It was getting dark, it was freezing cold. I, looking back, shouldn't have been out and about, but I was. And I pulled into Dunedin Town Hall. It was full of people. It was really crowded. And I felt sick as a dog. And this stranger, she was an elderly Māori woman, recognised me. Well, she just kind of singled me out really from somewhere within that hall, that big crowd of people. And, it probably wasn't hard for her to see at the time that I was really sick. And she just kind of singled me out from the crowd and came up and, bless her heart, just said, "Bub, you look like you need this." And she pulled out a white bottle from her handbag, and I looked at it and it had a label on it which said thieves oil. I'd never heard of thieves oil before, I didn't know what the heck it was, and she said, spray a couple drops of this under your tongue, give it a couple hours, see how you feel, and then give it another couple sprays, and you should start feeling better pretty soon. And then she sort of warned me and was like, "Oh, go easy, it's quite spicy." And so I kind of in my head had already resolved, like, I'm going to try and get to a GP first thing tomorrow morning, before I start this long drive back up to Tauranga. Maybe they can give me some antibiotics or something, who knows. And I was like, I'll try this in the meantime, whatever the heck it is. I definitely can't get any sicker, put it that way. So I sprayed this stuff under my tongue, and she was right, it burned. It was really spicy and peppery. And all I can say is that burning sensation, like when you eat really spicy food, just went from my mouth down into my body, and then from my feet up, my body cooked. And like, this isn't the scientific term to use, but what happened was it felt like my body just absorbed that oil and just spread it everywhere, and my body just heated up and heated up and heated up and heated up, and I was sweating. I mean, I was, it didn't help that I was pretty febrile when I went in there, really, but it just went next level after I used this oil. I'm peeling off layers of clothing, and I'm sitting in this crowded town hall trying to get through this kind of closing meeting of this conference, just cooking, actually cooking from the inside out. And then the only thing I can say that happened is all of a sudden my fever broke, and it wasn't like when you have been really unwell with some kind of cold or flu and you gradually start to feel better. It wasn't like that. What happened was I was sitting in this meeting trying to follow what was going on, but was really like, just had heaps of brain fog going on like you do when you're really unwell. Struggling to concentrate, struggling to focus on what was happening around me. And then, my fever broke, and then all I can describe really is that it was like the brain fog in my head just the clouds parted, and suddenly it was like, oh, I can concentrate, I can think clearly for the first time in 3 days. I can, I'm aware of what's going on around me. I'm starting to feel a bit more human now. And then over the next couple of hours, by the time that meeting closed, my sinuses cleared up, my throat stopped hurting, I still sounded really unwell, I still had, no voice, but I stopped coughing, and what I remember really clearly is my mental and emotional energy came back within that space of a few short hours, and that to me was really remarkable. By the time I got home that night, on the Sunday night, I felt completely well and normal. I still sounded sick, but all the congestion was gone. I could breathe clearly, I could think clearly, like I had emotional energy, I had mental energy, I was back into my okay, what's going to happen when I get back to work on Monday, like I'm back into work mode again. And it was just night and day from, whatever horrible illness I'd had before this oil to being basically completely well within the same night. So I went to drive home the following morning from Dunedin, and I was thinking, oh, I actually don't even need to go to the GP now, I feel completely fine. And I just thought to myself, what on earth did that woman give me? What the heck is thieves oil? Whatever it was, it did the trick, and I need to look into this because I've never recovered from an illness that quickly in my life. So I got back up to Tauranga, looked into what essential oils are, and then kind of, I guess, followed my curiosity a little bit in terms of how do they get used. While I was going through that process, I stumbled across something called the Oxford Brookes study, which is an incredible study done on a huge cohort of over 8,000 women. It's an older study now, but it remains, the largest and most influential study on the use of essential oils in labour and birth to date. So we will go into that later in this presentation. But once I read through the results of that study, which was specifically, how it benefited labouring women, or how essential oils benefit labouring women, that was all the convincing I needed. I was like, wow, I've had this quite dramatic personal experience with an essential oil, and there's plenty of research, oceans of research here to support their use in pregnancy and labour and birth and postnatally as well. I need to start applying this to my practice as a midwife. And so, for the next 3 years, I began to introduce essential oils into my full-time LMC practice. And like all good midwives, kept data and research and statistics on my birthing outcomes. And by the time I went to do my midwifery standards review in 2020, I had 3 years worth of data outlining, my use of essential oils as an LMC. And that was incredible. Collating that data was so eye-opening to me. Long story short, by the time I sat down with my reviewers and I handed them my statistics, they said, you've done a great job of breaking these down into individual, tick box requirements like we're supposed to do. But one of the reviewers said, have you actually stepped back and zoomed out and had a look at what your overall undisturbed birth rate is? And I was like, oh no. It was just doing the MSR requirements and ticking all the boxes and doing the breakdowns and the reflections and the blah, blah, blah. And I said, I don't actually know what my undisturbed birth rate is. And she said, Gillian, it's 83%. And I was really shocked by that. And she said, what do you put that down to? And I said, well, a few things. Definitely the judicious use of essential oils. So really kind of taking the time to learn which essential oils benefit individual women in different situations and different stages of labour, different emotional needs. I'd really invested a lot of time into understanding how essential oils benefit women from a holistic level to work on the limbic system and the neuro system, as well as chemically on the body. So that was a huge part of it. And then I also said, I work pretty closely with an amazing acupuncturist, and I'm fortunate that my demographic of women, most of them can afford acupuncture, so most of them go and see her. And a few other kind of minor things, but yeah, mostly I said, it's essential oils, I think. So that was a kind of a breakthrough moment in my midwifery practice, where I realized these things don't just have a placebo effect. They really impact women's birth experiences in remarkable ways, tangible ways that can be recorded in data and statistics, and we'll go into some of that further in the presentation. And more importantly for me as a midwife, positively impact their perception of their birth experience. And so I just think anything that's able to achieve that for birthing women can and should be recommended. And in this day and age, we have oceans of data to support their use. So let's get into it and have a look. So moving on from there, what are essential oils exactly? An essential oil is a distilled plant extract. That word distilled is really important. An extract can come from the root, the stem, the leaves, the flower, the bark, or the seeds of the plant. And the higher the quality of the oil, the higher its potency, so the more therapeutic benefit it has. Purity matters when it comes to essential oils, and we shouldn't confuse essential oils with things like fragrance oils or the essence of something, because those are effectively artificial representations of an essential oil. They don't really have a therapeutic benefit to them. They're just sort of synthetic copies. So pure essential oils are what's going to give you the most therapeutic benefit in a clinical setting. When it comes to essential oils, it's really helpful to understand that the essential oil within a plant cannot be mechanically extracted, so it can't be cold compressed or squeezed out or removed from the plant. It can only be distilled, which I think is really interesting. So for this reason, the distilled oil of a plant has historically been referred to as its soul or its spirit. Bear with me while we change screens. The Latin word for essential oil is quinta essentia, which literally means the fifth element. And this is because in ancient cultures, they viewed essential oils as having to be exorcised from the plant. So when ancient cultures were using essential oils, they basically viewed it as the oil was being given up. It was giving over its soul or its spirit to the user. And I find that really fascinating, because traditionally there has always existed a lot of crossover between the chemical and spiritual properties of essential oils. And for this reason, it's often viewed as a holistic treatment for soothing the soul as well as for the mind and body. And we will cover some of the sort of physical and chemical spiritual crossover, which is where the physics comes into it. It's one of my nerdy passions that I like to learn about. The historic background of essential oils. So the use of essential oils dates back thousands of years, and it's been documented by the ancient Greeks, the ancient Persians, and the ancient Egyptians. Essential oils were and still are commonly used in healing practices and religious ceremonies by every culture and people group on the planet. That says a lot, I think. How do they work? On lots of different levels. Essential oils work physically, emotionally, mentally, and holistically. Physically, they have an essential mechanism of action which involves the olfactory nervous system and the nose. It involves the limbic system, so the storehouse of emotional activity in the brain. It involves the circulatory system and it involves the respiratory system. So all four of these bodily systems can be stimulated by essential oils to release neurohormones directly into the bloodstream and take direct action on the body. How do they do this? When applied topically onto pulse points, and in particularly behind the ear or the wrist where the skin is at its thinnest, oils are absorbed by the skin directly into the bloodstream where they are quickly and efficiently distributed throughout the body. Now, the reason they can do this is because they are organic in nature, which means the body easily recognizes the core substance, and unlike pharmaceutical drugs, essential oils are able to pass more easily through cell membranes before taking direct action on the body. So basically, the human body loves essential oils because it recognizes them really easily and it knows exactly what to do with them. It knows exactly which part of the body to send them to. And there's no sort of barriers to the body distributing those oils, whether it's through the respiratory system or it's through the neuro sort of, there's different neuro pathways in the brain, but let's just call it neurohormonal for the sake of argument, and also the circulatory system. Essential oils can also be readily absorbed into the bloodstream by being inhaled into the lungs. And just a quick word there on using vaporizers during labor. So the olfactory receptor cells in your nose can become saturated after 20 to 30 minutes of diffusing, and this causes your sense of smell to turn off. So you've probably noticed if you've ever been in a room with a really strong fragrance or odor before, the longer you're in that room, the less you start to notice the smell. And then you leave the room, you go outside and you breathe some fresh air, and your olfactory nerves or your sense of smell resets itself. And when you come back into that room, you can smell it all over again, and that process starts again. So the therapeutic benefits of essential oils when they're being diffused, they're at their best within a 20 to 30 minute time frame. And after that, you are sort of hitting a saturation point with the body, and they can actually start to have a more of a negative effect on some people. So things like headaches, nausea, agitation, disorientation, and just sort of general unease, really, is sort of an indication that you've had your essential oils going for too long. I think that's worth keeping in mind in a birthing room because we're often closing doors and windows in birthing rooms, so the ventilation is not fantastic. But there still are, if you've hit your saturation point with the respiratory system, you can still use it in other ways on pulse points, compresses, acupressure points. There's different things that you can do to keep the positive effects of oils working during labour. Where are we up to? Mentally, so how essential oils work mentally is when the aroma of an individual oil enters the brain via the olfactory nervous system in the nose. Essential oils form a direct neurological pathway to the amygdala, the gateway to the limbic system. So they have a direct emotional effect on people, and where the use of individual oils for individual people becomes important is the body is much more likely to sort of resonate with an oil, so to speak, if it has a positive emotional association with that particular oil. So just, for example, lavender might have a really positive association for some people, and yet for others it might remind them of their dying grandmother and they hate the smell. So that oil is not going to be as beneficial to that particular person if it's used in the wrong way. And actually, the link between essential oils and the limbic system, using that neurological pathway via the amygdala, it goes a long way to explain some of the discrepancies in research outcomes. I'll get into that a little bit further into the presentation, but basically when you're looking at clinical trials around the use of essential oil in labour, they often have a blanket approach where they just use oils X, Y, and Z, to every single woman across every single phase of labour. And that's not always the best approach. The judicious use of essential oils, it does require a bit of an element of individualization because, as midwives would understand, one woman's stress might be caused by fear, one woman's stress might be caused by anxiety, one woman's stress might be caused by physical pain. There's different triggers, and we need to use the right oil for the right trigger. It's not going to be the same for everyone. Emotionally, because essential oils have direct access to the amygdala and the limbic system, they are able to produce powerful emotional effects that can either calm or stimulate the nervous system and its accompanying emotions. For example, lavender is a known anxiolytic that's been evidenced by thousands of studies. And essential oil is known to, orange oil, is known to have uplifting and an energizing effect on mood and emotions. Holistically speaking, essential oils work via something called the law of vibration. So we're going to get into that. I get very excited about the law of vibration. It's where one of the cool things about physics and quantum physics is it's where magic and science cross over a little bit. And essential oils are such a brilliant representation of the crossover between chemical properties and spiritual properties and why they're such an uplifting substance for people. So we'll get to that. Okay, what does the research say? Here we go, bear with me. So one of the most influential and widely recognized studies to date on essential oils, it's a little bit old now, but it's definitely the biggest study that's ever been done on the use of essential oils in labour. So it was carried out at Oxford Brookes University over an 8-year period from 1990 to 1998. The study included 8,058 labouring women, so a massive study, who were all birthing at Oxford University Hospital in the UK. During that study, this is amazing to me. Get your head around these statistics. The uptake of opioid pain relief amongst labouring women in that hospital typically sat around 30%. With the use of essential oils in labour, it dropped to 0.4%. I try to imagine the birthing unit that I work in, Tauranga Maternity Unit, if our use of opioid pain relief dropped to 0.4%. What would the impact of that be on our birthing outcomes? I feel like it would be significant, and I would just love to be able to accomplish some kind of outcome, that mirrors that. I wish there was a way that we could, but I just find that really inspiring. The use of essential oils in labour was consistently rated by women as a valuable component of their birthing experience. That's really positive. And data from the study indicated that the use of essential oils in labour facilitated maternal coping mechanisms by A. Improving the maternal sense of well-being. Helpful. Reducing maternal fear. That's massive. If we can find essential oils that consistently reduce maternal fear in labour, that's a huge achievement. Reducing maternal anxiety, another massive gain when it comes to promoting positive birth experiences. And finally, by positively influencing the perception of pain during labour. And interestingly, with the studies that I've read, most of that gain around the reduced perception of pain in labour, it tends to be in transition. So where women notice the biggest difference, the biggest benefit of essential oils in their labours, and that seems to be quite a universal outcome across pretty much every study, is reduced pain during transition, which says a lot about the state of the body in transition and its receptiveness to anything that's going to help, I think. Okay, so what does the research say? Well, I've actually got 3 literature reviews to cover. I've only got 2 here because when I put this together, there was only 2 available, but since then there has become 1 more. So we'll go through those In 2019, a meta-analysis of 17 different studies showed that the use of essential oils in labour, A, reduced the duration of established labour. Win. What midwife doesn't want that? B, reduced the duration of third stage. Another win. C, showed an overall trend towards a reduced duration of second stage. Some studies showed it, some studies didn't, but generally speaking, on the whole, most of them were trending towards a reduced length of second stage, possibly due to the reduced use of opioids in labour, but you'd have to get into some specific studies to make that comparison. D, reduce the perception of pain during transition. That is a common theme across a lot of the studies that have been done on the use of essential oils in labour. Interestingly, they showed no influence over the caesarean section rate. This particular literature review didn't indicate whether or not these women were low risk, and it didn't indicate whether these caesarean sections were elective or emergency. So I would like to know more about that particular literature review. And then finally, it showed no influence on inducing the onset of spontaneous labour, which I thought was really interesting. And the reason for that is when I was using essential oils in my own practice as an LMC, I noticed that my induction rate dropped really dramatically. So when this literature review shows no influence on inducing the onset of spontaneous labour, for me, I straight away think, I wonder if this is down to that blanket approach of we're using XYZ cocktail of essential oils for every single woman, regardless of her situation. And I think, I wonder if it had have been possible to individualize the use of specific oils for specific women, if you would have found that it did in fact influence the onset of labour. But that's a personal observation of mine. I could be wrong. So the second systematic review, and again, this has been sourced from PubMed. If you want specific references, let me know. I'm happy to share them. So there was a systematic review of 33 studies completed in 2020. 27 of those studies were conducted in Iran, and the rest were conducted through Korea, Egypt, Italy, and India. Every single study showed that essential oils effectively reduced labour pain and anxiety, especially in transition. And the interesting thing about this literature review, I thought, was that there's an essential oil called Damascus rose, which was shown to have a really consistent effect for all the women. Like I said, 27 of these studies were conducted in Iran. And for the Iranian women, Damascus rose had a really consistent result around the decreased perception of pain in transition just for those women. And then for the other women in Korea, Egypt, Italy, and India, the use of Damascus rose oil was sort of neither here nor there. So I find that fascinating. And again, I think it goes, it shows a lot that the right oil for the right woman is quite key to achieving the desired outcome that you want. Okay, and then our third study was a 2023 meta-analysis of 14 published peer-reviewed studies, which totaled 2,057 low-risk women in established labour. It indicated that the use of essential oils, in particular jasmine and lavender oils, in established labour significantly lessened the intensity of labour pain across all 3 stages of labour. 11 of the 14 studies showed the use of essential oils to be an effective method of labour pain management. We don't give essential oils enough credit for labour pain management. We're so quick to rely on morphine and epidurals, and absolutely, oftentimes they're the right thing. But essential oils also can be hugely effective if we give them a chance. And then 3 of the 14 studies showed oils had no influence on labour pain. So again, without being a scholar or an academic, my initial inclination is to think probably they were not using the right oil for the right person. But, we all know sometimes women's fear and anxiety is just so heightened that pharmaceutical intervention is the only option for them. So, okay. Coming into the law of vibration, so the holistic mechanism of action for essential oils. This is a little pet passion of mine. Albert Einstein, oh, sorry, let me get the right slide for you. Albert Einstein was quoted as saying, "Everything in life is a vibration." The law of vibration is probably something that you've been influenced by your whole life without being consciously aware of it. The law of vibration is a principle of quantum physics, and it refers to the vibrational rate at which individual molecules oscillate. The law of vibration is a featured component in string theory, in wave particle duality theory, and in something called quantum entanglement theory. So the only reason I mention that is to say the law of vibration is not some hippie hypothesis that might be true. It's sort of a recognized element of physics and quantum physics, which scientists work from on a regular basis. It's backed by science, is what I'm trying to say. Bear with me for a moment. The law of vibration acknowledges that all protons, neutrons, and matter exist in a state of constant interaction with each other. Therefore, everything in existence, I love this, from nanoparticles to interstellar galaxies, is in a constant state of motion. The speed of this motion is referred to as its vibration. The rate of this vibration is referred to as its resonant or its energetic frequency. So, all matter in existence, from human beings to inanimate objects, carries its own resonant frequency. And that is something that can be measured. So, you could go into a laboratory with scientists who know how to measure frequencies, and you could take in a piece of timber, a cell phone, a dog, a plant, a human being. Every single one of those things is going to have a resonant frequency that it's quietly vibrating at, that we know nothing about, on a conscious level, but on a subconscious level, our bodies are constantly tuning in to these resonant frequencies that are a part of all matter that's in existence. The frequency of a healthy human body ranges between 5 and 16 hertz. That range is debated a little bit by different studies. The most common sort of consensus, although there's conflicting studies around, what is the healthy frequency range of a human body, but the most common consensus is the 5 to 16 hertz range. The reason why there's disagreement there is an unhealthy body, human body, or a person who's just in a kind of poor state mentally and emotionally, their body is going to vibrate at a much lower frequency than somebody who's in a healthy, well, positive frame of mind. As a comparison, the frequency of an average houseplant ranges between 50 and 120 hertz depending on its stage of growth. So I don't know if you have heard this theory that if you want your houseplants to grow well, you should play them classical music. There's a reason for that. And that is, at certain stages of growth, plants are more receptive to the energetic vibrations that exist around them. And those energetic vibrations can produce positive or negative effects. So they've done studies on plants that show if you play them, I think it was like certain types of classical music that were in a certain frequency range, the plants grew a lot faster. And when they played them like death metal, the plants kind of shriveled up and their growth stunted. What's really interesting to me is those studies were taken one step further by a bunch of scientists in the southern states of North America, where they experimented with corn crops and used sound frequencies on a major agricultural scale to promote the growth of corn crops at certain stages of their development, and just found that, the corn crops grew way faster and produced a lot more, corn, fruit, I don't know what you call it, that a higher yield basically when they played these, certain, I think it was classical. It was to do with beta wave classical music over these crops. And notice a dramatic effect, basically. So the frequency of a cup of coffee has been measured at 3.5 to 4 hertz, And I read one interesting study where some scientists took some people into a lab, measured the frequency range of their bodies, gave them a cup of coffee, and as they held that coffee in their hand, the frequency ranges dropped, and then after they'd ingested the coffee, it dropped again. So the body, not my body loves coffee, but the human body in general apparently doesn't respond well to caffeine. You probably find the same thing with things like alcohol, junk food, processed foods, sugars, and stuff like that. I think the frequency of the human body is going to drop as its health and well-being drops. And then, just as a random comparison, the frequency of a laptop, 87.5 hertz. Okay, what has this got to do with essential oils? Essential oils have the highest energetic frequency of any natural substance. Full stop. So essential oils are the most pure, high frequency substance that can be freely used. Well, just full stop. But also, these really high frequency oils can be used on the body really easily. The body basically has no barrier to essential oils. So they range from 52 hertz as some of the sort of more earthy kind of herbal oils, and then they go all the way up to 320 hertz. So that's a really high frequency. That's rose oil. Why does this benefit women in labor? Because of something called sympathetic resonance. So sympathetic resonance happens when one vibrating body, you remember we're talking about a set of oscillating molecules, is influenced by another vibrating body, and they start to resonate at the same frequency. So if you think of the way that guitar strings naturally resonate with a tuning fork, that is sympathetic resonance in action, and the human body is no different. So, super quick interruption to my video there, just an additional note on sympathetic resonance, which I find fascinating, and I think midwives will appreciate, because we are often groups of women who are working in confined spaces together. So this is a super relatable, everyday example of the way you've probably been influenced by sympathetic resonance your whole life and never been aware of it. But as you notice, if you walk into a room and there's someone else in that room who's in a much, let's say they're in a much more grumpy mood than you are that day, and the longer you're around that person, over time, you may start to notice that your mood begins to match theirs, or it might be vice versa. It might be that you're the person in the grumpy mood and the other person is in a much more positive mood than you that day. And again, over time, you might find that your mood starts to improve to kind of match theirs. And that's a classic, I think, just a brilliant everyday example of sympathetic resonance at work, because what you've got in action there is, remember, two human beings with their own resonant frequency. So remember, two sets of oscillating molecules which, when they're brought into close proximity with each other, begin to vibrate at the same frequency. And so what that means is, as midwives, with each other, but also, the labouring women in our care, we have the capacity to elevate other people's mood and frame of mind by being aware of that sympathetic resonance. Like, where is my resonant frequency vibing at today? Am I high or low? And what impact do I want that to have on the people around me? Because, like I say, we so often work in close proximity together. Same way, it's not a hippie theory. It is a principle of quantum physics known as sympathetic resonance. So you're welcome. So if you take a labouring woman, she's exhausted, she's dehydrated, she's in pain, maybe she's stressed, whatever, her vibrational frequency is going to be really low at that time. If you are in a position to identify, the right oil that is needed, and you're guided a little bit by the clinical picture and a little bit by her emotional state, and you're able to apply that to her in the right way, whether it's on the soles of the feet. Soles of the feet are the single most absorbent part of the human body, so even more absorbent than the eyes and the mouth. So the soles of the feet are a really effective delivery mechanism for essential oils. Or you use it on a compress on her lower back if she's having, posterior labor, or you use it on her pulse points on her wrist, or you put it into a diffuser. Different circumstances are going to sort of require a different mechanism of delivery. But if you can introduce the right oil at the right time, that sympathetic resonance is going to kick in, and it's going to basically enable the body to elevate its own resonant frequency. So it's going to help to lift that woman out of her state of fear, anxiety, and tension, and into a state of, depending on the essential oil and depending what you're actually treating, but I would say acceptance, and cooperation with her body, basically, where you're facilitating a sense of calm. And that's directly on the neurosystem itself, depending on the oil, but it's also on emotionally on the limbic system, and through this mechanism called sympathetic resonance, where you're applying a really high frequency oil to a low frequency human body, and you're just allowing them to sort of begin to resonate with each other. I hope all of that makes sense. I hope I haven't glossed over anything too significant, but let's talk. I just want to finish now on the use of specific oils in specific stages of labor. Okay, prolonged latent phase. Best essential oils to use for a prolonged latent phase. Lavender. I think lavender basically is in every single situation here. You can use essential oils for so many things, antenatally, intrapartum, and postpartum, but just for the sake of time, I'm just sticking to these 5 situations: high blood pressure, placental release, posterior labor, transition, and prolonged latent phase. So prolonged latent phase, lavender calms the mind and reduces anxiety. Frankincense promotes deep breathing and emotional balance. It helps to reduce feelings of overwhelm, most effective when inhaled. Frankincense is a beautiful oil. Some people call it the king of oils. So prolonged latent phase, you're really wanting established labor to kick in, and frankincense just heightens all the bodily processes that are going on simultaneously within the body, and it enhances them, and it just gets things moving. That's probably the best way I can describe frankincense. It gets things moving. It's such a powerful oil. Roman chamomile soothes irritability and tension. Well, I'm trying to gloss through these. Transition, peppermint oil. Peppermint oil is a great pain reliever. And from my personal experience, I would say it doesn't take away the pain, but it helps you to work. It definitely helps you to work with the pain. I would say that for sure. Peppermint is wonderful for lower back pain and for posterior labor. A cold peppermint compress on the lower back of a woman who's having posterior labor, combined probably with frankincense to try and rotate a baby, like that's such a winning combination for posterior labor. Peppermint oil, also brilliant for nausea and vomiting. I think most people use it. Excellent for headaches. You put it on your temples up here. It relieves headaches really well. It can be a great energizer. Excellent for midwives when you're tired in a prolonged labor. Get some peppermint oil on your pulse points. Like, it's really just such a great rejuvenator, I find. Personally, I like to use it before I go for a run. I find it really helps. Use of lavender is good for every single thing. For encouraging baby's rotation, clary sage supports uterine contractions, and studies suggest that it encourages babies to rotate. Clary sage is best applied to the lower abdomen or massaged into acupressure points. I definitely find, in my personal experience, essential oils are enhanced by the use of acupressure and acupuncture. It just sort of really drives home that delivery mechanism. Okay, placental release. 4, 5. Essential oils for the use of placental release. Clary sage, again, stimulates contractions, supports release of the placenta. Jasmine, a beautiful labor oil, enhances uterine tone and oxytocin release. Jasmine is excellent for a stalled labor. and for getting things going again. Rose oil encourages uterine activity and emotional grounding. Geranium supports healthy circulation and aids the uterus in expelling the placenta. Cinnamon, known for its warming and circulatory properties. So if you're just working with a woman who's had like a really difficult third stage, and she's got the shakes and the shivers going on afterwards, cinnamon can just be such a soothing, comforting, body warming sort of oil to just help facilitate that third stage recovery. Okay, one of my favorite indicators for the use of essential oils is high blood pressure. I looked up a bunch of studies. High blood pressure is really interesting to me because there's been so many studies conducted on the use of essential oils for high blood pressure, both outside of obstetrics and within obstetrics and midwifery. So, and again, results are really consistent across the board. Marjoram is probably the single most highly evidenced use, like benefiting oil for high blood pressure. So, on a physical level, marjoram is known to lower the sympathetic nervous system activity. It facilitates vasodilation, and this has a direct effect on hypertension. So, too much marjoram can have adverse effects in pregnancy, so you just want to be judicious in how you use it. I certainly wouldn't be using it before kind of 28 weeks gestation, but from 28 weeks onwards, the cautious use of marjoram in increasing amounts as you approach the end of pregnancy can just be hugely beneficial for lowering blood pressure or keeping it in a healthy range. Lavender, again, anti-anxiolytic, works directly on the nervous system, helps promote calm, a sense of safety and reassurance, and so by default that then can reduce people's blood pressure. But all the studies sort of indicate that lavender has a direct effect on blood pressure itself. Ylang-ylang reduces palpitations and corrects hypertension. And then I'm just touching quickly on 3 more oils that don't have a direct effect on the vasodilation or the circulatory system, but they do help to reduce blood pressure through the limbic system and the nervous system. So clary sage reduces heart rate. So if you've got a tachycardic woman in labor or a tachycardic baby, clary sage can be really good to use, provided she's not contracting too much, because clary sage also promotes uterine activity. But as it reduces heart rate, it can help to alleviate a high blood pressure. Frankincense reduces anxiety and gets things moving, like it helps facilitate progress. And if that progress at that particular point of pregnancy needs to be a reduction in blood pressure, frankincense is just going to get right to that sort of, the body knows what to do with frankincense, and it will send it to the area of the body where it's most needed, put it that way. And yeah, the evidence shows that it does tend to reduce blood pressure. Finally, bergamot lowers cortisol production, reduces stress in women, and therefore reduces blood pressure. These are all peer-reviewed scientific clinical studies, which I have references for if you're interested. Most of these have come from PubMed. But yeah, happy to share the references if you want the evidence for it. Okay guys, so there you have my video presentation on the use of essential oils for midwives. Just to be clear, in accordance with the NZCOM consensus statement, this is not a formal training for midwives to be able to use essential oils. I am working on coordinating a study day before the end of the year for that purpose. This is simply a part of my presentation for my Quality Leadership Program application. Thank you so much for your time and attention. It has been a long one. That's because I'm just so passionate about essential oils. There's so much available to support their use, and I am really happy to discuss those resources with people anytime. So I look forward to your questions and your feedback, and especially if you have stories about your own experiences with the use of essential oils with pregnant women as a midwife. I am all ears. I would love to know about your practice history with that too.